It is 8:39 and we are on the Health Watch and taking a deeper dive into what happened to Buffalo Bills player Damar Hamlin. We know that he went into cardiac arrest during a game on Monday Night Football. Colloquially, a lot of us lay people more or less call that a heart attack and use those two terms sort of interchangeably. But they're not necessarily the same thing. So let's get to Dr. Syed Hussain. He joins us every week, and he's joining us live here from Trinity Health of New England. Doctor, good morning to you. How are you today?
Good morning. Doing well. Thank you.
Glad to have you here. I know usually we're talking about COVID, and we will in a minute. But first things first, can we sort of talk a little bit more about what exactly cardiac arrest is and what similarities and differences there are with an actual proper heart attack, like we usually call it?
Sure, Tim. That's a great question because sometimes these two terms are used interchangeably, but they denote different things that may happen to the heart. So a heart attack, for instance, is a blockage in terms of blood flow to the heart, whereas a cardiac arrest is more of an electrical problem where the heart stops pumping blood. So both have different causes that can lead up to a certain cardiac event. In this case, it appears that the player had cardiac arrest, which means the heart had stopped pumping blood. And that's why it's really, really important in such scenarios to get the heart to pump again. Otherwise, critical organs that rely on blood flow and oxygenation suffer as a result.
And they did, and they got it after about 9 minutes of CPR. The defibrillator was brought out, and they got that restored. So that's all we know right now. Anything more would be speculation, and I'm sure we'll wind up talking about that over the next couple of weeks as we learn more about his condition. But want to switch back to COVID a little bit. We talked about XBB 1.5, one of the newest variants that seems to be winning out in what seems to be a relatively crowded field of a lot of variants now. There's not just one dominant one at the moment. And there was 3 days ago an article in the Wall Street Journal that at least asked the question, are vaccines, as effective as they are, in any way driving a surge in a lot of new variants emerging? Do we know anything about that one way or the other?
Yeah, thank you for asking. This question has popped up repeatedly through the course of the 3 years, as you know, Tim, at least the last 2 years since we've had the vaccines in our midst. And no, there's no data to indicate that vaccine use is leading to new variants or driving a new surge of cases. In fact, what would happen is if there's unaddressed or unchecked spread of COVID-19, the fear is that it may spawn a new variant that is able to dodge vaccine-mediated immunity. But in no case is there any kind of evidence that indicates vaccines are driving a new variant. Yes, XBB.1.5 is gaining ground, and it has rapidly increase in terms of percentage of cases across the nation, but it remains to be seen whether it will drive a subsequent increase in hospitalization and death. So it's still early days in terms of this new subvariant.
Of course, we're talking about a lot of different winter viruses between that, the flu, the RSV, the usual ones that circulate this time of the year. Are we expecting any surge in overall sickness now in the coming weeks, now specifically that the holidays and holiday gatherings have wrapped up?
Well, it's hard to say. I think that the coming weeks will give us a clearer picture. But the good news, Tim, is that we've seen at least 3 weeks of consecutive declines in flu activity, flu cases, including hospitalizations across the country. Now, whether this is sustained or whether there's a little blip in terms of the holiday gatherings and especially travel that we saw remains to be seen. But the flu activity seems to be decreasing ever so slightly.
And that is some good news. Again, we cannot predict that it's going to continue, but it is a nice, mild surprise at this time of the year that we're trending in a good direction. Dr. Syed Hussain from Trinity Health of New England, thank you for joining us this morning, as you do every week. We certainly do appreciate the knowledge.
Thank you. I appreciate you having me.